Missed charges, incomplete notes, undocumented procedures. Are these just inevitable slips in a busy hospital, or are they preventable leaks draining vital resources right under our noses? The truth is, many common billing errors start long before the billing department sees a claim, often stemming from gaps in nursing documentation. You're focused on exceptional patient care, but were you ever equipped with the knowledge to see how your charting habits directly prevent costly RCM mistakes and revenue loss? Are you tired of hearing about financial pressures without knowing how you can be part of the solution? It's time to connect the dots between your documentation and the bottom line. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 6, we pinpoint common billing errors and how nursing can prevent them, written by Dr. Nicholas Abella. You'll discover the top culprits, identifying the most frequent billing errors originating from clinical documentation, from missed charges to incomplete treatment details. Your preventative power, understanding how meticulous, real-time, and complete nursing documentation is the key to stopping these errors before they happen. Actionable strategies, practical tips like using checklists, standardized language, and collaboration to improve charge capture accuracy and reduce claim denials. Guiding you through these essential strategies are your hosts, ICU nurse James Carter, BSN, RN, and nurse manager Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're into something today that's, it's kind of the backbone of how our hospitals run, and it really ties into the amazing work you all do day in and day out. We're talking about common billing errors and how your nursing expertise is like the first line of defense against them.
Absolutely. Think of this as your crash course in seeing how those detailed notes you take, how meticulous you are with your documentation, that actually has a huge impact on your hospital's financial health. And that directly impacts the quality of care you can give, right? We're going to break down some common pitfalls and, most importantly, give you some real strategies to avoid them altogether.
Yeah, the term billing might not exactly get everyone excited, right? It kind of feels like that administrative stuff that happens somewhere else in the hospital. But we're here to show you how connected it is to what you do every single shift. Your observations, those timely notes you squeeze in between patient care, that's the foundation of the whole system. When you get this connection, you become even more powerful, You advocate for your patients and your hospital, making sure all your hard work is recognized, gets reimbursed properly, and ultimately supports the amazing care we're all striving for.
Couldn't agree more. We're going to focus on 5 common billing errors where your role as a nurse is absolutely critical. We'll use some real-world examples to make it crystal clear how these errors play out, and this is the important part, show you exactly how you can be the one to prevent them. Get ready for some aha moments as we connect the dots between your charting and your hospital's financial success.
Okay, so let's jump right in. Why should nurses even care about billing errors? At first glance, it seems like an administrative thing, but what's the real impact here?
Well, think of it this way. Accurate billing isn't just about keeping the hospital's finances in order. It's the very thing that enables a hospital to keep its doors open, to provide the level of care we all expect. When we see common errors slipping in, like charges being missed, the wrong codes being used, or gaps in those all-important notes, the financial hit can be, significant. These mistakes can lead to insurance claims getting denied, payments being reduced, and a whole lot of extra administrative work trying to untangle the mess.
And this isn't just about numbers on a balance sheet, is it? This has a ripple effect on the care you can actually provide at the bedside, right?
Precisely. When a hospital loses revenue because of billing errors, it puts a strain on all their resources. That could affect staffing, the availability of the equipment you need, the crucial supplies, even investments in new technologies, things that impact your ability to deliver the highest quality care. So your awareness of these potential problems and your proactive steps to prevent them, it's crucial.
It's about seeing the bigger picture. Your attention to detail isn't just about neat records. It helps keep the entire hospital healthy.
Exactly. Our sources constantly emphasize that complete and precise documentation is so much more than just a good habit. It's the foundation for a smooth, efficient revenue cycle management system. Think of this system as the engine that drives the hospital's finances. It ensures that all those services provided are properly billed and paid for. Your notes, they're the fuel that keeps this engine running. And of course, they ensure those patient medical records are complete, telling the whole story of the care they received, which is vital for continuity of care.
It really changes how we view those notes we write, those charts we update. It's not just a task to check off, it directly impacts patient well-being and keeps the hospital afloat.
You got it. Sometimes there's this perception that billing is, off in its own little world, separate from the hands-on care we provide. But research is clear. Nursing documentation has a massive immediate impact on how accurate those bills are. When your notes have mistakes, missing information, it contributes to what's called revenue leakage. Basically, the hospital can't bill for the legitimate care you've given if it's not documented correctly.
So when nurses understand just how critical their role is in this, they become protectors of the hospital's financial well-being. It's not just about avoiding mistakes, it's about being a proactive guardian of the resources that allow us to provide the best care possible.
Couldn't have said it better myself.
Yeah.
Now let's dig into the specifics. What are some of these common billing errors we're talking about? And more importantly, how can nurses step up and prevent them? The first one that often tricks people up is missed charges. It sounds simple, but it can pack a real punch.
Okay, missed charges.
Right.
What exactly does that look like in the everyday work of a nurse? Paint us a picture.
Basically, it happens when a charge for something, a procedure, a treatment, meds, even supplies used for a patient, they just don't get recorded. And if it's not documented, well, it's like it never happened, at least as far as billing is concerned. You'd be surprised how much potential revenue hospitals lose because of missed charges. Studies show it can be a substantial amount, sometimes even a few percentage points of their total revenue.
Wow, that's a lot. Can you give us a real-life example, something that could happen on a busy shift?
Imagine this. A nurse gives a patient medication for pain, following all the orders and protocols perfectly. But in the middle of a hectic shift, maybe there's an interruption, or another patient needs urgent attention, that medication administration doesn't get logged properly in the EHR. No record in the system means no way to generate a charge for it. These might seem like small oversights, but when you multiply them across all patients and all those busy shifts, they add up to a big financial hit for the hospital.
So how can nurses be proactive and make sure those charges don't slip through the cracks?
The AAPC Knowledge Center is a fantastic resource. They really stress the importance of real-time documentation. That means making it a habit to record everything you do, every procedure, every med you administer, as close to the time you do it as possible. It's about making documentation a natural part of how you deliver care.
Makes total sense. Capture the information while it's fresh in your mind. What's the next common billing error we should have on our radar?
The next one is incorrect coding support. Now, let's be clear. Nurses don't assign those final diagnostic or procedural codes. That's the job of the medical coders, the specialists. But those coders depend heavily on the information you provide in your documentation to choose the right codes, especially for procedures and the complexity of the care involved.
So the details you write are basically the evidence the coders use to do their job.
Exactly. The details you observe, how you describe a patient's condition, their response to treatment, those specific interventions you do as a nurse, it all creates a picture for the coders, and that picture needs to be as complete as possible.
Can you give us an example of how a nurse's notes can make a difference in coding accuracy and how a lack of detail could cause problems?
Okay, let's say a doctor diagnoses a patient with, say, heart failure. The nurse's documentation might include details like patient reports shortness of breath, especially when lying down, noticeable swelling in ankles and feet, and fatigue even with minimal exertion. These specifics, while not the diagnosis itself, support a more precise code for the heart failure, reflecting the severity and complexity of the case. Resources like Health Catalyst and the Centers for Medicare and Medicaid Services, CMS, they emphasize how those clinical details validate the level of care provided. Without them, the coding might end up being less specific, leading to lower reimbursement, or the claim might even be denied because the documentation doesn't match the services billed.
So it's not just about what you do, but the specific details you include when describing what you see and the care you give.
Right on. Now, another common pitfall is incomplete documentation. This is when crucial information is simply missing from the chart, and it can create a big headache for billing.
What kind of details are we talking about here? The ones that often get missed but really matter for billing.
Think about specifics like the exact start and stop times for an IV infusion, the precise dosage of a medication, especially if it can vary, or the outcome of a specific nursing intervention. Like, if a nurse charts that they started an IV but doesn't record when it was finished and how the patient responded, well, the AAPC Knowledge Center and Revenue Cycle Home Health Insight, they point out this makes it almost impossible to bill accurately for that treatment. Insurance companies might question why it was needed or for how long.
So being thorough, capturing all those details, even the ones that seem small, is key to ensuring accurate billing and avoiding rejected claims.
You got it. The fourth common error where nurses can make a big difference is lack of documentation for ancillary services. These are services that patients get that might fall outside the main reason they were admitted, the primary medical or surgical focus.
Can you give us some examples of these ancillary services that sometimes get overlooked in the documentation?
Think about things like specialized wound care provided by a wound care nurse, respiratory therapy treatments, maybe nutritional counseling, even certain bedside tests. Often because these services might be done by different specialists or aren't the main reason for admission, they don't always make it into the main nursing notes. But the CMS and Health Catalyst, they're clear. Nurses need to document all these services in the patient's chart.
So even if it feels like someone else's responsibility, if you know a patient received an ancillary service, a quick note can make all the difference.
Exactly. A clear, simple note like, wound dressing changed, and patient education on wound care provided at 2 p.m. by wound care specialist that ensures this service is captured and can be billed. Without that note, the hospital's essentially given away a service for free.
Okay, what's the fifth common billing error where nurses play a key role in prevention?
That would be failure to document follow-up care and patient education. This is especially important now, with the emphasis on value-based care and making sure patients do well after they're discharged. Revenue Cycle Home Health Insight and Health Catalyst really highlight this. If those discharge instructions, the education you provide, aren't documented, it can affect reimbursement, especially if those payments are tied to things like preventing readmissions or meeting certain quality standards.
So it's not just about what happens while the patient is in the hospital bed, it's about setting them up for success once they go home.
Exactly. Things like patient and family taught how to take medications, potential side effects discussed, written materials provided, or referral made to home health agency and plan discussed with patient. Those details show the full scope of care and support accurate billing. It demonstrates a commitment to patient recovery, and that's what we're all about.
This is so helpful. We've covered 5 key areas where nursing documentation is absolutely vital for preventing billing errors. What are some practical steps nurses can take to, up their documentation game? What works?
Being proactive is key. One of the best things you can do is use checklists and standardized templates for your charting. Make them part of your routine workflow. These tools help you remember to capture all the essential information, especially the details needed for billing, consistently for every patient and every procedure.
That sounds like a great way to build those good habits and avoid missing anything, especially when things get hectic.
Definitely. And as we've discussed, real-time charting is so important. Documenting care as you provide it or right after drastically reduces the chance of forgetting important details or having to rely on your memory later, which, let's be honest, isn't always perfect.
Plus, real-time documentation probably saves time overall, less catching up to do at the end of a long shift.
You got it. And finally, good communication and teamwork between nurses and the billing and coding folks is essential. If you can create a feedback loop, nurses can learn exactly what needs to be documented for accurate billing, and the billing team can share insights on what commonly causes errors or delays. Everyone wins.
That collaboration is key. What are some concrete steps that hospitals or individual units can take to promote these improvements in documentation? What would you suggest?
Okay, so a great first step is creating procedure-specific documentation checklists. Second, offer regular training on documentation best practices and how it affects billing. Give nurses the knowledge they need. Third, make sure nurses have opportunities to connect directly with those billing and coding specialists, maybe through regular meetings or case reviews. It builds understanding and helps solve problems. And lastly, really promote and support the use of those real-time charting tools in your EHR system. Make it easy for nurses to do the right thing.
Okay, let's be real for a second. We often hear from nurses, I'm already stretched thin. How am I supposed to find the time to document everything in real time? That's a valid concern. What are your thoughts?
Oh, absolutely. I get it. Nursing is demanding. You're constantly on the move. But here's the thing. Taking that extra minute or two to document accurately in real time can save you a lot of time and hassle later. It prevents those headaches of having to go back and clarify things, correct errors, or deal with appeals because of billing mistakes.
So it's about being proactive, preventing those problems before they arise.
Exactly. And getting comfortable with your EHR system, learning all those little tools and features can be a game changer. Many EHRs have templates you can customize, quick text options for common phrases, even voice recognition. These things can streamline your documentation and make real-time charting much more manageable.
It's about finding ways to make good documentation a natural part of your workflow. For nurses who want to improve, where should they start?
Start by looking at any existing documentation checklists or templates for the procedures and tasks you do most often. Make it a habit to use them consistently. From there, focus on adding those key details in real time. Even a couple extra words to be specific can make a difference. Small, consistent efforts add up to big improvements over time.
This really highlights how connected a nurse's daily work is to the financial well-being of their hospital. It's a big responsibility.
Absolutely. By understanding what causes those billing errors and taking those steps to prevent them, nurses are playing a crucial role in keeping their hospitals financially stable. Maybe it's not always visible, but it's essential. When you document accurately and thoroughly, you're directly contributing to better billing and ultimately better patient care.
It's not just about avoiding mistakes. It's about building a sustainable healthcare system that can continue to provide the best possible care for all patients.
Exactly. You're taking ownership of your documentation, paying attention to detail that's a huge contribution to the long-term health of your organization, allowing it to continue its mission of providing essential care.
This has been a fantastic into a really important topic. For everyone listening who wants to learn more and connect with other awesome nurses, we invite you to join us at healthcarenurses.net. You'll find tons of resources, great discussions, and amazing opportunities to grow professionally. And if you want to stay connected on the go, download our Nurses Link Up app. It's on the Apple App Store and Google Play Store. It's the perfect way to share insights and stay in touch with your fellow nurses.
It's a fantastic platform for continued learning and networking. It's a great community.
We hope this has shed some light on the vital connection between what you do every day as a nurse and the financial health of your hospital. Remember, that commitment to accurate, thorough documentation, it's not just about paperwork. It's about ensuring we have a strong, sustainable healthcare system that can continue to provide top-notch care to all our patients.
Think about one small change you can make in your documentation during your next shift. What stood out to you today? What resonated? Even those small changes can have a big impact.
Thanks for listening to the Healthcare Nurses Network podcast.